This is Dr. Mobeen Sayed from React 19. I am the medical director and content director for React 19. I've been presenting COVID and vaccine related topics for a long time on YouTube as well. Today, I am thrilled that we have Mitsu with us, who is one of the researchers in the latest study that is a preprint from Yale Listen study, where there is a comparison between the long COVID symptoms versus the post-vaccine syndrome symptoms, and then even the overlap between those symptoms. So this is a fascinating area, and I'm so glad that there is some more data here for us to review. So Mitsu, welcome, and tell us a bit about yourself.
Dr. Saeed, thank you so much for having me today. This is such an honor. So just a little bit about myself. Originally, I'm a cardiologist, and then have been working with Dr. Krumholtz for over the last 3 years, and also Dr. Akiko Iwasaki, who is a well-known immunologist at Yale. So over the years, I've been working with them on the LISTEN study, which we will present the data today, and also the PAX-LC trial, which was a phase 2 clinical trial that tested the effectiveness of Paxlovid. So those were the key long COVID research that we have been working on. Now, today we dive into a more of a post-vaccine syndrome space. And we attempted to compare the symptomology of what we see or what is being self-reported from long COVID participants versus post-vaccine syndrome participants. So that's where we're at.
Excellent. Excellent. Thank you so much for joining us. It is an honor to have you and such an important study as well. So very quickly, I'm just going to give a few the URLs here, the web links here. So this is React 19. And this is the study Comparative Analysis of Long COVID and Post-Vaccination Syndrome, a cross-sectional study of clinical symptoms and machine learning-based differentiation. And here Mitsu's name is. Then there is an older study as well that is fascinating and I think kind of related as well. And that is this immunological and antigenic signature associated with chronic illness after COVID-19 vaccination. So this is the study we are discussing today. Mitsu, tell me what was the objective, what was the thought behind doing this study?
Thank you, Dr. Saeed. So, the main question that we try to answer here is that, what are the similarities? What are the differences between people who are suffering long COVID and comparing them with post-vaccine syndrome? So, I mean, that was kind of the one question that we wanted to answer. So, in order to do that, we delve into a little bit like a sophisticated method where we took machine learning techniques in order to find certain patterns of symptoms that are being reported from patients within the listen study community. So we took one cohort, one from the long COVID cohort, and then one from the PVS cohort, and then ran a what we call the clustering analysis. And also and then what we find out is that from these 682 individuals, machine learning models identified symptoms between long COVID and PVS. And in the long COVID group, it was characterized as, well, so this is going to be a long list, but these are the symptoms that popped out through this method. So long COVID symptoms seem to be associated with strongly with brain fog, altered sense of smell, and shortness of breath. And while on the post-vaccine syndrome side, we saw burning sensations, neuropathy, numbness, these like neurological symptoms, more reported in terms of like a higher frequency. So that's what we kind of found out as the main question and also the finding in our paper, but happy to dive in even further.
That is excellent. And looking at the time frame, so you started this study from 2022, or you had data from 2022 May till July 2023, and then you spent time for analysis from July 2023 and May 2024. How extensive was the data? And I have one curiosity. Uh, was this all the self-reported or self-filled surveys, or there were some uh, diagnostics as well that were connected to the data?
That's a great question, and that also speaks about well, what we call limitations of the paper itself and the study design. So this, in short, all the symptoms were collected based on self-report. So these are surveys, questionnaires that we have sent out online. We wanted to make it accessible to many people as possible. That was kind of the foundational thought process that we had when we were conceptualizing the study itself. So this started out as like an online community back, and then called Kindred, Hugo Kindred. And then from there, we constructed this more like an academic cohort, what we call Listen. And we wanted to distribute the surveys, questionnaires online. So this is something that we have termed as decentralized studies. And we wanted to make it accessible to anyone living in the US. So that was that was the thought process there. And then um, we also wanted to do a biospecimen collection because obviously that's going to be helpful to understand even further. So that's what Dr. Said showed in terms of the medRxiv paper. The other paper is on actually the collection of the biospecimens that we were able to collect from the US states. And so this is, but this is all under Yale University IRB, has been approved, but it's not like a traditional multi-site mega study. It's just a single IRB, but approving access to people and having making the study or participation to studies possible to anyone across the states.
Understood. Thank you
Mhm.
so much for this one. So there is a question here as well, and I think I want to ask that upfront. That helps us create some context as well. And the question is from Una: can you have both long COVID and post-vaccine syndrome?
Yes, short answer would be yes. For this specific study or the report that you see on medRxiv right now, we intentionally had separate cohorts for that. So we actually had people reporting both. But since it's a little bit difficult to tease out the differences between the two syndromes, we intentionally had excluded that cohort for this analysis. But there are people who are reporting both. And it's a little bit difficult to differentiate, which happened first. For instance, was it the PVS first, long COVID first? How do you know? I mean, these questions are still there. I mean, we haven't still answered the question how to like define PVS, how to define long COVID yet. So like that's a little bit of like another step of an advanced question. So we wanted to simplify it in terms of the research, but there are overlap, I believe. Yes.
Understood. Thank you. There is one more question before we dig deeper into the findings. Question is from Denise. She's saying, and I believe Denise is part of the study as well. What were the similarities between the two syndromes, and were there more similarities than differences?
That's a great question. And yeah, short answer to the second question is that yes, so the majority actually do overlap, but so there's a long tail, and then the tail may be the what matters in terms of defining the differences between the two. So let me just take a look at the similarities in terms of the symptoms. I'm gonna touch on that once I find that part. Um, So like we did run a analysis called a clustering analysis. And so there were three type of buckets, if you will. And then, so the first bucket, we labeled it as the neurological. So this was mostly PVS. And then the second bucket, we call this multi-system, which means that it was a long list of 87 symptoms. So anything that seemed to be not under the neurological bucket actually were there. So that's a lot of symptoms, right? So what you see on the screen here, some multi-symptom system, predominantly long COVID, and one dominated by so the last one, that's the third bucket. This was called the psychiatric and sleep. So this was seen more frequently in the long COVID bucket. So I wish I have the set of symptoms here, and unfortunately, so I just noticed that the figures are not here, but I'll make sure to upload them on the medRxiv and make them visible and available. I mean, so yeah, and that should be done in a couple of days.
Okay, excellent. So, what is my so Denise, thank you very much for your question. Una, thank you for your question. My understanding from looking at these findings, it seems to be, and I may be wrong, it seems to be that long COVID patients tend to be more uh, central nervous system issue or having symptoms with the central nervous system versus the post-vaccine syndrome seem to have the differentiator of peripheral nervous system damage. Is that a correct generalization or there are nuances?
Great question. And that's the pattern that we see, but it doesn't mean that long COVID patients cannot have neurological or peripheral neuropathies. It doesn't mean that and then it goes the other way around. So it doesn't mean that PVS patients do not have brain fog or central nervous system type of problems. It's just a pattern and the frequencies that we see. So we're not excluding or like we don't want to dismiss a certain set of symptoms just based on these clusters. So this is just in terms of like clustering from this analysis, these are the patterns that we see.
Understood. And then talking about the clustering, so if I can read a couple of sentences from the study where it says main outcomes and measures, symptoms data were analyzed using clustering techniques to identify groups with shared symptom patterns. A gradient boosted machine learning model was used to determine the most distinguishing symptoms between long COVID and PVS. So I have a question. What is this gradient boosted machine learning model?
Great question. We do have great data scientists here at Core. Actually, I mean, they did the magic, but I mean, in lay terms, I mean, can try to explain this a little bit. So the gradient boosted trees here are like a type of like a machine learning model. And so it builds many small decision trees. So like if you have certain set of symptoms, yes or no, and then if you try to differentiate between the two groups by a yes or no, you come up with smaller trees, if you will, and then it combines them to make accurate predictions. So it's if you set like a certain threshold, and under that threshold, the learning model tries to differentiate the different patterns there in a set of trees. So that's what's happening here.
Understood. Thank you very much. And I'm going to just read these three sentences that you actually just described before as well. And I have a question there. So you said that in this clustered analysis, one enriched for neurological symptoms and post-vaccine syndrome. The second one characterized by multi-system symptoms and predominantly long COVID. And then one dominated by psychiatric and sleep symptoms, also primarily long COVID. So let's consider this that for the time being, these are the main differentiator, although there may be the overlap. The neurological symptom is more focused compared to when you say long COVID multi-system. And that multi-system may be neurological plus the pulmonology and other systems too. Did you have any discussion about why the post-vaccine syndrome differentiator is more towards neurological and less towards multisystem,
That's
at
a
least
great
within the
question.
context of your study?
That's a great question. And the why, I mean, we want to understand why. And also, like, actually, in the very first series of what we published from the Listen study, it was actually on internal vibrations and tremors in long COVID participants that we were able to publish. So this is also available on medRxiv. Um, So it doesn't mean that these peripheral neuropathy type of symptoms are only in PVS or only in long COVID. But I mean, getting back to your question, yes. So, Miss, Dr. Said, would you mind like repeating that question again? Sorry.
Absolutely. So the question was that it seems like post-vaccine syndrome um, symptoms, at least in the context of this study, seem to be more toward differentiating towards neurological symptoms, while the long COVID seem to be involving more multi-system. And the reason I ask this question is there are post-vaccine syndrome patients who may have cardiovascular issues or who may have clotting issues or even musculoskeletal issues. So when there is a more focused differentiation on the neurological side, what is the reasoning for that? Why less long,
So
multi-system in vaccine versus long COVID?
obviously, I mean, we talked a whole lot about the overlapping pathomechanism. I mean, this is on the spike proteins. So both post-vaccine syndrome or like the vaccine itself, and also long COVID or the COVID-19 infection itself would have the human body to be exposed to spike proteins. So that's kind of what's overlapping. Now, then what's the driving these differences? That's the question that Dr. Saidi, I mean, I think that's why you're asking.
Correct.
And honestly, I mean, this is a tough one. I mean, we do not know.
Hmm.
We don't understand. So we have to understand, go back to the kind of the differentiation of the pathomechanism that's going like happening behind COVID infection versus what's happening for vaccination. So I mean, I think you can hypothesize that maybe the COVID infection itself has a more multi-organ effect. It has more drastic inflammation, or um, the virus itself can also be infecting multiple um, systems within the body. So that could be the case. Whereas vaccination maybe a little bit towards certain sets of your body or like certain organs of your body. Um, but I mean, honestly, we don't really know. So
Understood. Understood. And I'm just going to put a conjecture out there, and that, of course, is not related to the study itself. But it does seem like in the case of vaccine, there may be cross reactivity, which is more with the neurological tissues and proteins compared to the other. But this is interesting area. So then the follow up that I have for you is, uh, does this mean that there may be more studies in progress or being thought about that may give us some more data for, let's say, biomarkers and then pathology, eventually leading up to some intervention? At the end of the day, someone who is vaccine injured or who has long COVID, they basically want to understand, what do we do now? How do we become better? So, do you have more studies planned and thought out?
great question. So the study that we talked about briefly in the introduction, the biospecimen collection and the immunophenotyping report, which is also available in medRxiv, that is kind of what we have been doing in the Listen study in order to find biomarkers. So biomarkers meaning that what these markers can, how they can differentiate between these two conditions, or in comparison, like what's the control, what's being normal versus how do you define PBS. So like that was the intention of the immunological study that Akiko and
This one.
Bernal. Yes, that's the one. That's the paper that we were working on. Of course, I mean this is pattern recognition. So from there, we have to take it even further and hypothesize that certain agents that are already available in the healthcare space, which is used for other medical conditions, but can that be also used for treating or at least alleviating the symptoms that we see for post-vaccine syndrome? So that's the direction that people would like to see, obviously. And there is a talk about discussion about running another um, sequel to the biospecimen collection and understanding and characterizing more about post-vaccine syndrome. So I cannot mention like very specific details about certain studies or trials, but there are certainly a future studies that are being discussed.
That is awesome. And once again, combining these two studies, the immunological study that showed us a fingerprint, then this study that showed us at least there is a differentiation that can be seen even when there is a lot of overlap. These two combined actually provide us a very good guideline for how to move forward to be able to start helping these patients. Hopefully, then pathogenesis becomes a little more clear, and then interventions become more targeted towards these biomarkers and related pathologies and these symptom related pathologies. So, amazing work. And I have a question, and you can totally decide not to answer this question. Uh, Many of the mainstream organizations, institutions have not taken up this area of work with enough enthusiasm. Yale, I'm seeing that there are many studies that are now coming out. Uh, how did Yale decided or your team decided to look at these to look at the post-vaccine syndrome and related issues?
Dr. Say, thank you for that great question. Obviously, it takes courage and also like more of a just scientific curiosity where this and also wanting to help out people who are reporting who are suffering from these set of symptoms. So that's kind of the where we started off. It's more of me myself. I mean, I'm a physician, and also it's Dr. Krumholz's wishes that he wanted to understand and why people are suffering in midst of the COVID pandemic. And obviously, long COVID participants was the big the population that we wanted to reach out to initially. But then we learned that there are a certain set of people who have continued suffering long after they got vaccinated. And uh, we didn't want to kind of dismiss that. I mean, we wanted to hear their voices, and that's where we started off. So this is not really about politics, taking sides. It's just about pure understanding of what's happening out there. And remember, I mean, back in the pandemic, it was really hard to communicate with people in person. I mean, this doesn't happen. So we wanted to build it online. And that's where we started. And thanks to all the participants, we were able to create enough sample size or like a data set that can be analyzed. And that's what we were able to present here today. Um, but again, I mean, the scientific community, and it's so setting the politics side aside. Um, I mean, it's also about researchers who are in this field. Well, we need to do better in terms of defining the condition. It's still been very vague. I mean, it's there have been attempts to define it, but it's not really a fixed definition, and we haven't found. This goes back to the problem of biomarkers. So we need an objective type of marker that can clearly identify patients. So that's where we're at. And um, yes, that's where we need to do the most in terms of the defining the symptomology. And okay, so the other part is that even though there has been a lot of like long COVID work done in the space, not necessarily post-vaccine syndrome, but long COVID, even in that space, there have been attempts to measure people's symptoms based on standardized scales or standardized instruments that have been developed for previously known conditions. For instance, dysautonomia, POTS. These symptoms or these type of syndromes have been have been around for a while, and so it has been defined in the medical community. Now, do people who are self-reporting dysautonomia, who are self-reporting long COVID as well, do they clearly match these like really tight criterias that have been defined in the medical community? And that's where we're struggling as well. So there's a little bit of like a disconnect, a less association with what we already have defined versus what we see from the self-report. And so it comes in like two layers where it's one is a little bit like a science, the politics side, but the other is also not fitting the status quo, the traditionally identified set of symptomology. So and then it's totally fine that medicine finds a new pattern, but it takes a lot of effort to make a strong case and actually come up with a good definition. And that's where we're still at, unfortunately.
Understood. And it makes sense. And an opinion, my opinion, so that is nothing, uh, it's not necessary that React 19 agrees with it or the researchers, Mitsu and the team agree with it. But I do believe that whenever we have a product, any intervention, that there is always the way we study those intervention or know about them is to say, here is the mechanism of intervention, here is why it is needed and when it is needed, and here can be the side effect of that intervention, here could be toxicities of those. This is just normal medical sciences. And so looking at vaccine related product and its side effects as well, that is actually an important set of data points to collect to complete the picture. And that would help even for the future interventions as well, to say here are things to be aware of or fix. So once again, Mitsu, thank you so much for you and your team that you're working on it. I have a few questions from audience, if you don't mind, I'm going to ask. There is a
Yes.
question from uh, Pete. Pete says, do you see any instances of elevated rheumatoid factor in the study participants?
Thank you for that question. Honestly, we haven't collected rheumatoid factors systematically, so we can't really make any comparisons. We've had people connecting their EHRs for some of our participants, um, but it's not a clear pattern that we see from like previous studies or any of our EHR studies. Um, but I'm sure, I mean, there are people who have rheumatoid factors elevated as well.
Understood. Thank you very much. C. Wallace says, can you speak more to musculoskeletal system disorders and connective tissue damage in post-vaccine syndrome? What biomarkers might identify such symptoms? So musculoskeletal system
Yep.
disorders.
Thank you for the question. Again, uh, of course, I mean, there are people who have musculoskeletal system disorders and, connective tissue damage that has been reported in association with their PVS. Um, biomarkers, I mean, we haven't really found any for these set of symptoms. And then I mean, it might be a more of a question for our team member at Kiko's lab, Bernali, for instance. She may have better answers to this. I mean, she's a great, phenomenal immunologist, and yeah. So if you can bring her on another session, she might be able to answer
Absolutely.
those questions. Yeah.
Absolutely. I would love to. Thank you. Una has a question, a follow-up, another question. Can you touch a little on preconditions, neurological, being exacerbated by specialists in total denial? Is it lack of knowledge? So I think the question is that if we are not managing it, we're not approaching these conditions as if they may be post-vaccine syndrome conditions, which then let the patient continue to deteriorate. Is it lack of knowledge?
That's a great question. So obviously there has been probably, well, I can't say, but I mean, there might have been a lot of denials or also hesitancy towards, I think admitting that it may be related to vaccine. That's the first part. Um, and yes, I mean that could have resulted in these neurological symptoms. That is true. And actually that brings up like a great point because this is like a self-report type of study. And we don't know how long, well, we have a broad idea, but the symptom duration may also we may have to take that into account. The trajectory of these symptoms may differ between long COVID and PVS, and that's probably what we see in the literature as well. And then whether or not when the participants decide to come into the study, that may also reflect the symptomology or the major symptoms that we see in these cross-sectional surveys. So, it's going to be helpful to us if we have more of like a longitudinal type of study where we ask surveys multiple times to understand how these symptoms change. So that's also something that's missing. And it's a difficult because not everyone responds to the same set of surveys all the time. But I think we need those type of studies as well.
Understood. Thank you for that. And before I ask some more questions, something that just struck me, and I wanted to articulate that and get your comment as well. I think this is the very first study that is helping guide that there could be a difference, as much as there is overlap, there could be a difference between PVS and long COVID. Am I correct?
I believe so. I mean, I haven't seen any other literature like this, and this is quite unique. Again, I think I mentioned, I mean, we were thinking about this from 2 years ago. We finally put this together. So happy to present it, but I mean, wish we had done this even earlier. Yes.
Yeah, absolutely. So for the audience here, this I have not, so I have read about 12,000 studies related to long COVID and vaccine and COVID. I have never seen a study that actually provided this type of a guideline to say there could be a difference and here is what could that difference be. And then you map that on the immunological study as well. So you start looking at the possible reasons too. So once again, thank you to your team and you for doing this research. I'm going to ask a few more questions. So there is another question. In this study, was spike protein measured quantitatively in relation to symptom severity in PVS patients, higher levels found in those with worse symptoms, or was spike protein only assessed qualitatively as a presence absence finding? And I think that there was no measurement of spike, but what is your comment, Mitsu?
In this study, no. However, I mean, in the immunological the paper that again, or you get back. I mean, I think this is the third time, but that immunological antigenic signature paper, we may have had that. Again, so this is only on post-vaccine syndrome, so it's not comparing against long COVID participants. So it's always important to have a comparator. For instance, always in like these basic science research papers, having a good set of control groups is always necessary to make a comparison of whether or not one certain, for instance, in this case, post-vaccine syndrome has even like elevated spike proteins. I mean, that's kind of like obvious, but I mean, it has to be shown in uh, quantitative manner. And so if we and we're still running these analysis, and then if you are interested in, we may also have like future studies that may necessitate control groups as well. So if you are willing to, I mean, we're going to post this online obviously when we're ready, but please stay tuned and yeah, please look forward to our future studies. And if you can participate, that'll be even better. Yep.
That will be amazing. Thank you so much for that. A couple of more questions, actually, three more questions. Alice says, I was in the listen study, but my symptoms got much more severe after falling out my initial survey and getting additional boosters. I was never able to find a way to update the researchers about the change in my condition.
Thank you for sharing that experience. And I feel like terrible to hear that. I hope some of your symptoms may be getting better, but yes. So I kind of briefly talked about following up participants on the listen study, and we actually have I actually have done that in last year, late in probably in November, December. We're still collecting that data and trying to understand the symptom trajectory of this is on long COVID participants, so not necessarily on post-vaccine. However, we do see that I can't really disclose a whole lot of information, but we do see that majority of participants have not recovered well in terms of like
Mm.
overall health status and overall symptoms. So that's very disturbing. And if that's even worse due to certain set of like another episode of COVID infection or even like vaccination, um, yeah, I mean, I think these exposure to the particle, it could be spike proteins or other um, elements that are included in that episode that's exacerbating your symptoms. Again, I mean, we have to dive in as scientists and understand this better. But yeah, if you can share your experience and also maybe even participate in one of these like biospecimen collection, I mean, that would be helpful to understand the overall picture.
Understood. Thank you very much. And Alice, my apologies. Instead of reading filling out, I read falling out. So my apologies. It was filling out. Um, Denise has a question. Interesting that both groups suffer from internal vibrations, which is such a unique and specific symptom. Wonder if this points to a common mode of injury.
Great question. And yeah, I mean, I think there's possibility that that overlap um, may help us find a certain set of biomarkers. Um, but again, I mean, we're actually trying to think about this in a little bit more focused way. It's one set of symptoms that we are highly interested in right now, dysautonomia, so autonomic dysfunction, um, and also these peripheral neuropathies that we see. So I don't know if we can label internal vibrations and tremors as peripheral neuropathy. It's more like it's a subjective set of symptoms that people have been reporting. But for the sake of like trying to categorize this in certain buckets, I think we can call these internal vibrations tremors as peripheral neuropathies as well. It could be central though, like it could be a perception. So
Hmm.
we need better tools to assess this. I mean, many of the neurologists here at Yale, also they have also neurologists who are investing their research work into this space, um, and running nerve conduction testing, for instance, or MRIs of head, and I mean, all these going to be helpful. Again, I mean, there's if you so everything will count, and if we put this together, and I think we may be able to find certain patterns to help define this condition.
Understood. Thank you. One more question uh, from Anonymous. Are you seeing brain lesions in individuals with post-vaccine syndrome? If yes, are they consistent with MS or something completely different that is new science, the COVID mRNA vaccines?
Again, great question. In our study, we do not have information on brain MRI or anything like that. Um, we have very small number of participants who have also connected their medical records. I don't think we have seen any like brain lesions in PVS patients. However, I mean, again, this gets back to running a comprehensive study on trying to understand this symptomology and um, I mean, there has to be a more efforts and to be to understand this. And I guess I mean the research it's not easy. Obviously, I mean, and it's also about finding the budget, and also like we have to find the participants. So if you can, and I think, the way that we approached in a decentralized manner kind of helped to build this in an efficient manner. But I mean, obviously it's not enough. And there are other like more national level, like for instance, the Recovery Initiative, where they have done this in a comprehensive fashion, but I've there hasn't much output as we expect. There might be, so collaborations and more work is obviously going to be needed.
Understood. So I think these are the questions that I have and the audience have. Is there any other comment that you would like to make before we break about the study or the work in general?
Yes, well, thank you, Dr. Said. So I think I just want to like emphasize that we as Yale researchers, I mean, we are, pro-vaxxers. I mean, we want to, I mean, vaccine. We don't we're not taking it as like a political issue. And then this is not an anti-vaccine paper. So it's more from a science perspective that we want to understand the difference between these two set of symptoms or syndromes. Um, and we did see a couple of patterns, and these may be the points that we may want to focus in terms of understanding better in terms of the biology behind these conditions. Um, and this is kind of like repeating myself, but I mean the science, it is moving forward, but it's very gradual. So every help and every voice, every biospecimen that you may be able to provide to researchers, I mean, that's going to be helpful to understand. And there's going to be more efforts to find cures and treatments. And I think that's going to be the most important part of this the journey. Um, and on the long COVID side, I mean, there are multiple trials running throughout the country in the US. One of them is one from our fascinating collaborator, David Petrino. He's also running that in New York, NYU, um, um, sorry, Mount Sinai. Um, and yeah, so we were like hoping to see some treatments down the road, and obviously for PVS as well. Um, yeah, I mean, I think that's kind of what we're hoping for, and we do hope that people would feel better and let us know if anything seems to have worked. I mean, obviously, these going to be highly valuable information. We do have to analyze it in a scientific manner, but I think every type of information is going to be helpful at this point.
Understood. Thank you so much. Thank you so much for being here. Thank you for working with your team to move this science forward. Yes, it is moving slowly, but it is important to have the data points, not only to help those who are suffering at this time, but also to either prevent those who may develop these issues in the future and fix the product, or be aware that who should have it in what dose, etc. So there are so many things that are going to base upon these data points. And so thank you very much for doing that. And thank you for joining us today.
Thank you for having me.
Absolutely. So with this audience, thank you very much for your time as well. We will continue to have more discussions around these topics. And as more data comes out and more studies come out, I would request Mitsu to join us as well. With this React 19, thanks to them as well for helping with these kind of studies and participating in them. So all around, kudos to everyone who is involved. Thank you and bye for now.